A report released by the Kaiser Foundation shows 8 in 10 people have been duped by one or more coronavirus myth.
We've all heard 1 or 2 or maybe 5,000. So let's go ahead and bring in NewsAid's medical reporter, Dr. Mary Gillis, to separate fact from fiction.
Okay, hi guys, thanks so much. Right, facts from fiction. So here with me now to discuss the survey findings is Vice President of Medical Affairs at Franciscan Health. He's been a critical part of our coverage here at News 8 during the pandemic. So Dr. Doering, misinformation has been rampant since the start of the pandemic. Some of the myths that we're going to be talking about, should a person believe them and not get vaccinated as a result of believing these myths, I mean, you can end up with COVID and you can end up dying. So, I mean, it's really serious.
Yeah, the consequences can be dire for sure. And so it's important for us to do the best we can to try to help educate people and help them understand where to separate truth from myth in these cases.
Right, so we're glad that you're here to help. Okay, so first one, ivermectin is a safe and effective treatment for COVID-19.
Yeah.
What is ivermectin and why is it not?
Yeah, ivermectin is a medication that's been around for a long time to treat parasitic illnesses. It's certainly very effective at that. It's actually gotten a lot of, has had a lot of benefit globally for the effectiveness there. Unfortunately, early in the pandemic, we were trying a lot of different things to treat COVID. Ivermectin was one that had some promising studies early on that did not stand up to the scrutiny of peer review. The evidence, unfortunately, fell flat. Some of it was just outright fabricated. So unfortunately, ivermectin is neither effective at treating or preventing COVID-19.
Right. So we have the poll here that shows, I believe, how many people that we have? Okay, so 14% of people believe this to be true, and 40% don't know if this myth is true. So that's quite a percentage. Okay, on to the next one. Let's take a look. Okay, you can get COVID-19 from the vaccine.
Absolutely false. There's no virus in these vaccines. So that is an absolute impossibility with any of the 3 vaccines that are currently available in the United States. Certainly you can get symptoms that mimic some mild COVID symptoms, just like flu vaccines can mimic flu symptoms, that type of thing. But no, you cannot get COVID-19 from a COVID vaccine.
The spike protein is not in the genetic makeup
Nope.
or in the technology. It's not the coronavirus. Right. You are not being injected into the coronavirus. Okay, so 14% believe to be true, 10% don't know if it's true. Okay, it is not true. You cannot get COVID from the vaccine. Okay, next one. COVID-19 vaccines contain a microchip. Do they?
No, they do not, thankfully. And the truth of the matter is we've had a Herculean effort to develop these vaccines back in the early days of the pandemic. The Trump administration certainly put all the resources that needed to be put behind it, a very open, transparent process. There is no microchip in the COVID vaccine.
Okay. All right, so let's see. The data says, okay, 7% believe this to be true, 17% don't know if it's true. It is not true. There is no microchip. Okay, the vaccines can change your DNA. They don't?
Yeah,
Why
the
not?
mRNA vaccines actually do use your own cells to create a component of the spike protein. So it's a pretty innovative and miraculous technology. Does not enter the nucleus, does not affect the DNA whatsoever. Not possible, can't happen, completely false.
I know. That's factually wrong. Okay, so that's very interesting because DNA is part of it, but it's not going to change anything. Okay, so 8% believe to be true, 13% don't know for it to be true. And you know, Dr. Doering, while I have you here, I want to ask your perspective. What role does the public have in educating themselves about the pandemic? I mean, because we can only do so much. Have these specials, report on it. I don't know. What are your thoughts?
Yeah, and unfortunately, there's some other findings in that Kaiser report is that the sources people trust for their information are all over the map. And unfortunately, those who believe the myths, for the most part, are not trusting in reliable sources. They're getting their information from social media, from areas that do not provide evidence, or it's purely speculative. And so that's unfortunately, that's where we find ourselves today.
Okay. Thank you, Dr. Doering. I appreciate it. Phil and Alexis.
Thank you so much. Hey, kids and